High triglyceride levels are associated with increased cardiovascular risk, but whether reducing triglyceride levels would lower the incidence of cardiovascular events is uncertain. Pemafibrate, a selective peroxisome proliferator activated receptor alpha modulator, reduces triglyceride levels and improves other lipid levels. In a multinational double-blind randomized placebo-controlled trial, more than 10,000 adults with type 2 diabetes, a fasting triglyceride level of 200 to 499 milligrams per deciliter, and an HDL cholesterol level of 40 milligrams per deciliter or lower, were assigned to receive 0.2 milligrams of pemafibrate twice daily, or placebo. All patients were either receiving lipid-lowering therapy or had an LDL cholesterol level of 100 milligrams per deciliter or lower. The primary endpoint was the first occurrence of a major adverse cardiovascular event, defined as the composite of myocardial infarction, ischemic stroke, coronary revascularization, or death from cardiovascular causes. At a median follow-up of 3.4 years, a primary endpoint event had occurred in similar numbers of patients in the two groups, despite lower triglyceride levels in the pemafibrate group when measured at 4 months. At 4 months, the pemafibrate group also had lower levels of VLDL cholesterol, remnant cholesterol, and apolipoprotein C3, and higher levels of LDL cholesterol and apolipoprotein B. The overall incidence of serious adverse events did not differ significantly between the two groups. The pemafibrate group had a higher incidence of renal events and venous thromboembolism, and a lower incidence of non-alcoholic fatty liver disease. The authors conclude that among patients with type 2 diabetes, mild to moderate hypertriglyceridemia, and low HDL and LDL cholesterol levels, pemafibrate reduced triglyceride levels but not the incidence of cardiovascular events. Full trial results are available at NEJM.org.